Time for another session of Registry review questions. Let's talk image optimization in breast ultrasound. Question 1. When optimizing a breast ultrasound image, the blank ultrasound control should be adjusted so that there is equal brightness at all depths, from the skin to the chest wall. A. Gain, B. Frequency, C. TGC, or D. Depth. And the answer is C. TGC. TGC stands for time gain compensation. And this is a control on an ultrasound machine that changes the brightness level at different depths in the tissue. Note that it amplifies signals that have already been received back from the transducer, and it does not affect the strength of the pulse sent into the body. On a breast ultrasound, the TGC control should be set so that there's equal brightness at all depths, from the skin to the chest wall. Question 2. This ultrasound control increases or decreases image brightness by changing the strength of the sound pulse that's sent into the body. A. Output power, B. Gain, C. TGC, or D. Frequency. And the answer is A. Output power. The output power control is one of the 3 brightness controls in ultrasound, and it increases or decreases image brightness by changing the strength of the pulse that's sent into the body. Ideally, output power should be set to the lowest level that produces a diagnostic image to decrease the risk to the patient. Question 3. To improve the ultrasound image below, blank, to eliminate Cooper's ligament shadowing and increase image detail. A. Increase the gain. B. Decrease the frequency. C. Decrease the output power. Or D. Increase transducer pressure. And the answer is D. Increase transducer pressure. Transducer pressure or compression is the amount of pressure applied with the transducer to the patient's body. In the breast, transducer pressure should be firm enough to produce a crisp image with high image detail and to eliminate Cooper's ligament shadowing. When the pressure is too light, you get artifactual shadowing and decreased image detail. Question 4. When optimizing a breast ultrasound image, the blank ultrasound control should be adjusted so that the fat in the breast is a medium gray color. A. TGC, B. Output power, C. Depth, or D. Gain. And the answer is D. Gain. Like the TGC control on an ultrasound machine, the gain control is also a brightness control, and it increases or decreases the overall brightness of the ultrasound image by amplifying signals that have already been returned to the machine. So it does not affect the strength of the pulse that's sent into the patient's body. Ideally, for a breast ultrasound, the gain control should be set so that the fat in the breast is a medium gray color. Question 5. Which ultrasound control should you adjust last in order to optimize the ultrasound image below? A. Increase the gain. B. Increase the output power. C. Increase the near and midfield TGC. Or D. Increase the far field TGC. And the answer is B. Increase the output power. The output power control should always be adjusted last because it directly affects the strength of the pulse sent into the patient's body. When adjusting ultrasound machine controls, it's important to always have the safety of the patient in mind. And therefore, to change the brightness of an image, you should always adjust the gain and the TGC controls first before adjusting output power. Question 6. To optimize the ultrasound image below, blank, to increase penetration through the deeper breast tissues. A. Increase the gain. B. Decrease the frequency. C. Increase the output power. Or D. Decrease the TGC. And the answer is B, decrease the frequency. The frequency control is always a fine balance between level of resolution and the need for penetrating through the tissues. When the frequency is set too high, there's high resolution throughout the image, but a lack of penetration, meaning the tissues in the deeper part of the breast are not well visualized and pathology can be missed. Question 7. When optimizing a breast ultrasound image, the blank ultrasound control should be adjusted so that the pectoralis muscle is located at least 3/4 of the way down the image and can be clearly visualized in the far field. A. Gain, B. Depth, C. Frequency, or D. TGC. And the answer is B, depth. On an ultrasound machine, the depth control determines how deeply the ultrasound sound waves are penetrating into the breast tissue. When the depth is set too deep, the breast tissue is too small and far away in the image to visualize subtle pathology. When the depth is too shallow, you cannot visualize the pectoralis muscle or the tissue that's deep in the breast, which can result in missed pathology. Ideally, on a breast ultrasound, the depth should be set so that the pectoralis muscle is about 3/4 of the way down the image, and the pectoralis muscle can be clearly visualized in the far field. This ensures that you're seeing that deeper breast tissue. Question 8. When optimizing the ultrasound image below, blank, so there is higher image resolution throughout the deeper breast tissues. A. Increase the gain. B. Decrease the depth. C. Increase the near field TGC. Or D. Move the focal zone lower. And the answer is D. Move the focal zone lower. An ultrasound control, known as the focal zone, narrows the ultrasound beam in the region where the focus is located. This increases the image resolution in that region. On a breast ultrasound, ideally you want to use multiple focal zones so that you have high image resolution throughout the image. This will decrease the frame rate, but frame rate for a breast ultrasound is not as important as it is to other types of ultrasound. It's more important to have high image resolution throughout the image so that you can spot subtle signs of breast pathology. When a solitary focal zone is used and is placed too high in the image, you're only going to have high image detail in the near field of the image. So when it's necessary to use a solitary focal zone, it's important to move that focal zone to a level where it's at or below the area of interest, which in this case would be at or below the lower edge of the breast tissue or the pectoralis muscle. This will ensure a decrease in artifacts in the far field. Moving that solitary focal zone lower will result in better resolution than if it was higher in the image, but to truly spot subtle pathology in the breast, multiple focal zones should be used. Question 9. When optimizing the ultrasound image below, blank to visualize the deeper breast tissues and the chest wall structures. A. Increase the depth. B. Increase the number of focal zones. C. Decrease the frequency. Or D. Decrease the gain. And the answer is A, increase the depth. When the depth is too shallow, the image is so zoomed up that you cannot visualize the chest wall structures or the deeper breast tissue. Ideally, on a breast ultrasound, a correct depth setting would show the pectoralis muscle about 3/4 of the way down the image. This ensures that you can easily visualize and interrogate the deeper breast tissue. Question 10. When optimizing a breast ultrasound image, the blank control should be set to the highest level that allows penetration through the breast tissue and down to the chest wall. A. Gain. B. Output power. C. Frequency. Or D. Focal zone. And the answer is C, frequency. The frequency control should be the first control adjusted at the start of every breast ultrasound exam. It's important to adjust this control early before further optimizing the image, because you want to ensure that you have adequate penetration throughout all of the breast tissue and down to the chest wall. If the frequency is set too low, there will be low image resolution. So it's important to use the highest frequency level that allows penetration throughout the breast tissue. This will ensure that you have proper penetration and the highest possible image resolution. Question 11. To optimize the ultrasound image below, blank so that the fat in the breast is a medium gray color. A, increase the gain. B, increase the frequency. C, decrease the output power. Or D, increase the midfield TGC. And the answer is A, increase the gain. When the gain is set too low, the image is too dark and you cannot distinguish tissues and structures from each other. Ideally, the gain should be set so that the fat in the breast is a medium gray color. Question 12. These two ultrasound brightness controls boost the signals already returned to the receiver and do not affect the strength of the sound pulse sent into the body. A, TGC and gain. B, gain and output power. C, TGC and output power. Or D, frequency and gain. And the answer is A, TGC and gain. The TGC and gain controls amplify signals already received back to the machine by the transducer and therefore do not affect the strength of the sound pulse sent into the body like the output power control does. When adjusting brightness on an image, the gain and the TGC controls should always be adjusted first before the output power control. Gain affects the overall image brightness, and TGC affects image brightness at different depths in the tissue. Question 13. When blank is insufficient, the ultrasound image displays an increased amount of artifactual shadowing. A, gain. B, transducer pressure. C, TGC. Or D, depth. And the answer is B, transducer pressure. When insufficient transducer pressure is applied, as in image A in this diagram, there's increased shadowing from the Cooper's ligaments, and image detail is hazy. Image B in this diagram represents where a transducer is in relation to the skin when using a standoff pad. And then image C represents proper transducer compression when doing a breast ultrasound. Transducer pressure should be firm to produce a crisp, high detail image and eliminate artifactual shadowing in the breast. Question 14. To optimize the ultrasound image below, blank so that there is equal brightness at all depths. A, increase the far field TGC. B, increase the gain. C, increase the frequency. Or D, increase the near field TGC. And the answer is D, increase the near field TGC. In the first image, the near field or the top of the ultrasound image is too dark. You can't make out structures or layers of the breast tissue. Using the TGC control to increase image brightness at just this depth will ensure that you have equal brightness from the skin layer all the way to the chest wall. Question 15. This ultrasound control affects image resolution and penetration and represents the number of sound wave cycles occurring per second. A, output power. B, frequency. C, gain. Or D, focal zones. And the answer is B, frequency. Frequency is the number of sound wave cycles occurring per second. The higher the frequency, the higher the image resolution, but the lower the ability to penetrate through the tissue. And conversely, the lower the frequency, the higher the level of penetration, but the lower the image resolution. Ideally in the breast, you want to use the highest frequency that allows adequate penetration throughout the breast tissue. Question 16. When optimizing a breast ultrasound image, multiple blank are used to provide high image resolution throughout the entire image? A. Focal zones, B. Depths, C. TGC controls, or D. Frequencies? And the answer is A. Focal zones. Multiple foci should be used in breast imaging since frame rate is not as crucial in breast ultrasound. When only a solitary focus is used, there's only high image resolution in that one zone of the breast tissue. Since many breast pathologies are subtle and small, it's crucial to have high image resolution in all zones of the breast tissue. Therefore, at least 3 or even 4 foci should be used to ensure high image resolution at all depths in the breast tissue, with the lowest foci being placed at the lowest edge of the breast tissue or at the pectoralis muscle. Question 17. When this control is adjusted to an insufficient level, there is a lack of visualization of the deeper breast tissues, and pathology can be missed along the chest wall. A. Gain, B. Near field TGC, C. Depth, or D. Focal zones? And the answer is C. Depth. When the pectoralis muscle is not located about 3/4 of the way down the image, this means that the depth control is not adjusted properly for a breast ultrasound. If the depth is insufficient, you cannot see the deeper breast tissues and pathology can be missed along the chest wall. Question 18. To optimize the ultrasound image below, blank to provide higher image resolution. A. Increase the output power. B. Increase the gain. C. Decrease the number of focal zones. Or D. Increase the frequency. And the answer is D. Increase the frequency. In the first ultrasound image, the frequency is so low that there's low resolution throughout the image, which could result in subtle or small pathology being missed. The correct frequency setting is used in the second image. In the second image, there's higher image resolution, but still adequate penetration throughout all of the breast tissue. Question 19. The principle of ultrasound safety, ALERA, primarily applies to which ultrasound control? A. TGC, B. Gain, C. Frequency, or D. Output power? And the answer is D. Output power. The ultrasound safety principle known as ALERA, which stands for as low as reasonably achievable, requires that we always adjust ultrasound system controls with the safety of the patient in mind. Ideally, we always want to use the lowest output power that produces a diagnostic image, since output power changes the strength of the pulse that's sent into the patient's body. Using an unnecessarily high output power increases the risk to the patient. Question 20. To optimize the ultrasound image below, blank so that there is equal brightness at all depths. A. Increase the gain. B. Increase the far field TGC. C. Increase the output power. Or D. Increase the near field TGC. And the answer is B. Increase the far field TGC. In this image, the far field, or the bottom portion of the ultrasound image, is too dark, which means that you cannot delineate any of the structures or layers of the breast tissue. Increasing the TGC at this depth will ensure that you have equal brightness at all depths and do not miss pathology deep in the breast tissue. Question 21. The narrowest part of the ultrasound beam, where resolution is at its highest level, is the blank. A. Far field, B. Focus, C. Near field, or D. Above the near field. And the answer is B. Focus. An ultrasound beam starts out at the transducer as the same width of the transducer, and then it gradually tapers to the narrowest portion of the beam. This is known as the focus. It's the region with the highest resolution, and then it wildly diverges in the far field. The area immediately above and below the focus is known as the focal zone. In this region, image resolution is also high. The focal zone control on an ultrasound machine narrows the ultrasound beam at the level where it's placed on the image. In breast imaging, you want to use multiple focal zones so that you have narrow regions throughout the ultrasound image, resulting in high image resolution throughout the image. This way, subtle or small breast pathology is not missed. Question 22. The 3 brightness controls on an ultrasound machine are A. Frequency, gain, and TGC. B. Output power, frequency, and gain. C. Gain, TGC, and output power. Or D. TGC, focal zones, and gain. And the answer is C, gain, TGC, and output power. Gain, TGC, and output power are the 3 brightness controls on an ultrasound machine. Gain and TGC boost signals that have already returned to the ultrasound machine and do not affect the strength of the sound waves sent into the body, while output power changes the strength of the pulse sent into the body. Therefore, gain and TGC should always be adjusted first, and output power only used as a last resort when gain and TGC are not adequate. Gain increases or decreases overall image brightness, as does output power. It increases or decreases the entire image brightness, while TGC increases or decreases image brightness at different depths within the tissue. Question 23. When a single focal zone is used, it should be placed blank for better image resolution. A, at the bottom edge of the breast tissue. B, in the near field. C, in the midfield. Or D, near the chest wall structures. And the answer is A, at the bottom edge of the breast tissue. On the ultrasound image to the right, the red circle represents the focal zone control. In this image, it's actually placed a little bit lower than you'd ideally want it placed. The arrow represents the ideal location, which is at the bottom edge of the breast tissue at the junction of the pectoralis muscle and the breast tissue. When using a solitary focal zone, this is where you want to place your focal zone. Ideally, however, you want to use multiple focal zones in breast imaging so that you have high resolution at all depths in the tissue, with the lowest focal zone placed at the level of the arrow on this image, which is the junction of the bottom edge of the breast tissue and the pectoralis muscle. This ensures you have high resolution throughout all of the ultrasound image. Question 24. To optimize the ultrasound image below, blank to provide better visualization of small or subtle pathology in the breast tissue. A, decrease the frequency. B, increase the gain. C, decrease the depth. Or D, increase the near field TGC. And the answer is C, decrease the depth. When the depth is set too deep, the breast tissue is too far away in the image. It's hard to make out anything because it's so crammed into the near field portion of the image. In order to adequately visualize small or subtle pathology in the breast tissue, you need to set the depth so that the pectoralis muscle is located about 3/4 of the way down the image. This ensures adequate visualization throughout the breast tissue. Question 25. To optimize the ultrasound image below, blank so that the fat in the breast is a medium gray color. A, decrease the midfield TGC. B, increase the output power. C, decrease the gain. Or D, increase the frequency. And the answer is C, decrease the gain. In the first ultrasound image, the gain is set too high, which results in lack of visualization of the tissues and the layers of the breast tissue. In the next ultrasound image, the gain is set correctly. Ideally, in breast imaging, you want to set the gain control so that the fat in the breast is medium gray in color. Interested in more registry review practice questions? Don't forget to like, comment, and subscribe, and tune in on Wednesdays for new videos.